Fractures cause pain, decrease mobility and function, and are associated with decreased quality of life and increased risk of death. And if you are a woman in your 40s or 50s experiencing hot flashes, mood swings, and body pains, then this episode of Health Point is for you. Hi, my name is Anahis Patel, and I'm a certified health and nutrition coach. Welcome to another episode of Health Point, a short 5-minute show that brings you meaningful health and wellness tips from reputed doctors. Did you know that being a woman puts you at an increased risk of developing osteoporosis and broken bones? By 2050, the worldwide incidence of hip fractures in women is projected to increase by 240% compared to the rates in 1990. The risk of a subsequent fracture is particularly elevated in the first 2 years after an initial fracture. Fragility fractures are the fourth leading cause of chronic disease morbidity. Nearly 75% of all hip fractures occur in women. Today we have with us Dr. Hrishikesh Pai, President of the Federation of Obstetric and Gynecological Societies of India, or commonly known as FOGSI. So, let's understand more about fractures in women in detail from Dr. Pai. Welcome, Dr. Pai.
Thank you for having me again. Osteoporosis is a condition characterized by the weakening of bones, making them more fragile and prone to fractures. Now, why this especially relevant to menopausal women? There is a significant drop in the estrogen levels. Estrogen plays a crucial role in maintaining bone density.
Are there any specific areas of the body that women should be extra careful about?
Hip fractures, in particular, can be especially debilitating, often requiring surgery and extended periods of rehabilitation.
What can women particularly do to protect themselves from osteoporosis and potentially life-altering fractures?
Well, there are several strategies women can adopt. First and foremost, ensuring an adequate intake of calcium is very crucial. Dairy products, leafy grains, almonds, and calcium-fortified foods are excellent dairy sources.
Are there any other key measures that women should adopt?
Yes, regular bone health assessments are equally important. Women should discuss with their healthcare providers and consider bone density scans such as dual energy X-ray absorptiometry called DXA scans as recommended. These scans can detect early signs of bone loss, allowing for timely intervention.
Dr. Pai, thank you for shedding light on this extremely crucial topic. Now, let's see what our other doctors have to say about this.
Osteoporosis is a skeletal disorder where the person experiences low bone mass and degradation of bony tissues. Many times, osteoporosis is not discovered until weakened bones cause painful fractures, usually in the back or hips. Young women with a lower bone density caused by a low peak bone mass are at increased risk of getting osteoporosis in later life. Many postmenopausal women do not present for fracture risk assessment, resulting in underdiagnosis and undertreatment of the disease.
I've myself had 2 family members with severe osteoporosis. This can manifest with severe back pain, loss of height, and a stooped posture. Menopause and postmenopausal periods, when osteoporosis typically emerges. In the first 2 years of menopause, we want to look after vasomotor symptoms, that is, patient feels excessive heat, irritability, depression, crying spells, difficulty in having intercourse, recurrent urinary tract infection. But this lasts for about 2 years. Then is when the main problem starts. Osteoporosis starts, dyslipidemia starts. So there is a sudden increase in heart disease in patients. There is a sudden increase in osteoporosis in patients. Prolonged period of low hormones, irregular or absent menstrual periods, and certain medical conditions like cancer, ovarian surgery heighten the risk of bone loss.
Getting enough calcium throughout your life helps to build and keep strong bones. So, eat foods high in calcium. Take care of your bones so your bones can take care of you. That's all for now. See you next week, and don't forget to keep it healthy.